of getting your flu vaccine is Dr. Abisola Olalade. Dr. Olalade, how are you doing today?
Great. Thank you so much for having me.
Well, it is our honor to have you once again. We all saw Dr. Redford, Dr. Fauci, and a lot of other people with the initials MD after their name talking about how this flu season could be extra perilous because of COVID-19. I assume you agree with them.
Absolutely. And so, we are seeing the effects of COVID and what happens when we don't have a vaccine against a virus. And so going into flu season, we know that this is going to be a threat amplifier, meaning that the presence of one amplifies the threat from the other. We're going to be seeing people going indoors, and we already know that flu season strains our hospital capacity by itself. And having COVID as well, unfortunately, is a cause for big concern. So one of the primary ways, in addition to wearing a mask, watching your distance, and washing your hands, one of the primary ways that you can protect against COVID is by getting a flu vaccine, and it's important for everyone to remember that.
So I was noting prior to our conversation, doctor, that I've had the flu vaccine, I can remember now, 7 straight years. I'm 6 for 1 as far as getting the flu. Am I doing better than average, or does that sound about par for the course as it relates to, because the vaccine doesn't mean that you're not going to get the flu, correct?
Absolutely, and this is a very good point, and really kudos to you for doing that. I want to say that, but it is an important point, and we should dispel a lot of the myths surrounding the flu vaccine. One of which, as you mentioned, is that it doesn't necessarily mean that you're not going to get the flu. It's impossible to protect against all the strains of the flu, and it gives you a 60% reduction in your risk of getting it. It's not 100% reduction in the risk, but 60% is pretty significant. The other thing to remember is that even if you do get the flu and you've had the flu vaccine, it reduces the severity of you getting, it reduces the severity of the effects from the flu. So it's important for that reason to get it. And also, another thing that sometimes happens is that if you don't get it in time, because it takes 2 weeks to build your immunity once you get the flu vaccine, if you don't get it in time, that might be a reason why you still get the flu after getting the flu vaccine.
Yeah, I'm going this weekend. So, but a lot of people that I talk to about this, and I'm sure you hear it all the time, you get the vaccine pushback. Let's address those folks right now.
It's important. It's definitely important. Yes, it works. It is effective, and you should make sure that you do get it. A lot of those myths are just not things that are true. You can't get the flu from getting the flu vaccine, for example, is another one that I hear. And remember that when you get it, you are helping to protect your community overall, because we know that it will reduce the strain on our hospital capacity. The more people that get the flu, the better. What we've seen, unfortunately, with previous flu seasons is that there is a decrease in the amount of people that get the flu vaccine, but we need more people to get it. And we've seen the CDC say we want at least 65 to 70% of people to get it. And unfortunately, the rate of people getting it has traditionally been less than 50%. We really, really need everyone to hear this.
It also brings up, because you were saying if it's effective in 60% of the time or for 60% of the people, it also brings up a cautionary tale as it relates to the COVID-19 vaccine and expectations, does it not?
Well, yes, it does. And, we want to remember that, a vaccine may not be the end all be all in terms of COVID-19. We still have to practice all these things in terms of washing your hands, wearing a mask, all of that. And so, that is a new normal that we're going to have to accept. And certainly, even after a vaccine becomes available, it may take some time, to immunize everyone or most people against it. So, yes, that is true. It is a good point.
Dr. Olalade, thank you very much for making time for KUSI once again. I will, I'll wear I got my virus or flu vaccine virus button on my lapel on Monday, okay?
That's awesome. Really, really good. Thank you so much for having me. Good job.
All right, talk to you later.